supply all the pelvic genitourinary organs like your urinary bladder, male reproductive or female reproductive organs. In the parasympathetic neurons, the preganglionic fibers are long, whereas postganglionic fibers are short. This was opposite to the our sympathetic nerve condition. Some summary of parasympathetic neurons and synapses. Preganglionic neurons will be long enough, will be larger in length, synapse with the postganglion neuron at ganglia. They will secrete acetylcholine to activate nicotinic receptor on postganglionic neurons. Whereas the postganglionic neurons are very short in length, they will synapse on the target organ. They will release again acetylcholine to activate muscarinic receptors on the target organ. So here we can see anatomical difference in sympathetic and parasympathetic divisions. Sympathetic thoracolumbar T1 to L2 we have already discussed. Parasympathetic cranial 3, 7, 9, 10 cranial nerve and S2 to S4. Differing location of ganglia means that the ganglia are in different positions, like this one. It will innervate the eyes. Parasympathetic is innervating the eyes, salivary, heart, lungs. And this is from vagus nerve. This is from the glossopharyngeal. This is from the oculomotor nerve. Again, vagus is also supplying the stomach, pancreas, liver, and gallbladder, whereas the S2 to S4 segment is providing parasympathetic to the bladder, genitals. We can see from T1 to L2, where sympathetic is supplying eyes, skin, salivary glands, lungs, heart, stomach, pancreas, liver, gallbladder, adrenal, bladder, genitals. So you can imagine yourself when you are in rest, and also imagine yourself when an angry dog is running behind you. What will be a differences you will observe? Do some self imagination. Innervation by the autonomic nervous system. Dual innervation. There are some organs which are supplied by the both parasympathetic and sympathetic nervous system. So, for example, in the heart, vagus is a predominant factor for controlling rate. Like vagus is factor means it's a part of parasympathetic nervous system. So vagus will be working under the parasympathetic condition. So you can imagine your heart in the condition of parasympathetic when you are resting. Blood pressure is low. Your blood pressure is low, and blood flow also become low. Organ receiving sympathetic innervation, just like this one, adrenal medulla, which only receive sympathetic innervation. Pleomotor muscles and sweat glands. Control blood pressure is mainly a sympathetic activity, like they can maintain the blood pressure adrenal medulla by epinephrine, norepinephrine. You can see here, this is all sympathetic, this is parasympathetic. I already explained this in previous slide. Now parasympathetic division, like this one from oculomotor, this will cause the constrict pupil of the eye. From the glossopharyngeal, it will stimulate the salivary gland secretion. From the vagus, constrict bronchi and lungs. It will slow the heart. stimulate the activity of stomach and intestine to digest. It will stimulate the pancreas to release the digestive enzyme. It will stimulate the gallbladder to release the bile. It will promote empty of bladder micturition, promotes erection of genitalia, like we are having sex. Second one is the sympathetic division. You can imagine yourself when you're in sympathetic division, your pupils will dilate. There will be inhibition. You will seem thirsty in that condition because there is there is lack of salivary secretion by salivary gland. Your heart rate will, your breathing rate will be increased because bronchi are relaxed. Accelerated heart means your heart will be pounding on you. Inhibit the activity of stomach and intestine. Inhibit the activity of pancreas. Stimulate glucose release from blood, liver to maintain your blood glucose in fight or flight mode. Stimulate adrenal medulla to release the epinephrine or norepinephrine to maintain your blood pressure. Inhibit the emptying of bladder. Promote ejaculation and vaginal contractions. So let's. There is a third division of autonomic nervous system, that is the enteric neurons, which are present in our digestive system. It's the collection of nerve fiber that innervates your GIT, gastrointestinal tract, pancreas, and gallbladder. This function works independently from the CNS, and it controls the motility, exocrine and endocrine secretion, and microcirculation of the GIT. It is modulated by both sympathetic and parasympathetic. Okay, it's working independently, but it is modulated by parasympathetic and sympathetic nervous system. Like these effects will be occur. Neurotransmitter in sympathetic and parasympathetic nervous system. You can see that in sympathetic and in parasympathetic there is acetylcholine in sympathetic ganglions. You can see here all conditions, but the things are a bit different when we talk about the neuromuscular, not neuromuscular. When we talk about the uh, junction between the any tissue or gland and the postganglionic fibers, because in sympathetic there may be acetylcholine in some certain smooth muscles of blood vessels, skeletal muscles, again we know that, and sweat glands, where norepinephrine is released in cardiac muscles, smooth muscles, and glands. But some smooth muscles have acetylcholine, just mention here. Whereas in parasympathetic, we have acetylcholine again at the junction between the postganglionic fibers and the muscles of cardiac muscles, smooth muscles, and glands. There is acetylcholine. So there is a nicotinic receptors for acetylcholine. So adrenergic receptor for norepinephrine, muscarinic receptor for acetylcholine. Difference between SNS and PNS means sympathetic nervous system and parasympathetic nervous system originate from T1 to L2 spinal segment, whereas in parasympathetic craniosacral 3, 7, 9, 10 cranial nerve and S2 to S4 rare spinal region. These are the means that brainstem and spinal region both are working here. Distribution, they have widely distribution in our body, they have limited distribution. Ganglia, ganglia are away from organs. whereas in PNS on or close to the organs. We can saw earlier. For example, this is the ganglia of parasympathetic. It is located near, whereas in parasympathetic there is away. Postganglionic fibers in SNS are very long, whereas in PNS they are very short. This is a main difference. Whereas pre to post fibers ratio, we can say that in sympathetic nervous system, the preganglionic fibers are very small. So the ratio is 1 to 20 ratio or 1 to 100 ratio. Means that 100 times is postganglionic fibers are 100 times larger than preganglionic fiber. Whereas in PNS, the ratio is 1:1 or 1:2. Both are equal, or maybe sometimes the post is greater. Transmitter, transmitter in SNS, they are norepinephrine or acetylcholine, whereas in PNS there is acetylcholine. Stability of the transmitter Na stable, nicotinic are stable, whereas acetylcholine is rapidly destroyed. Important functions: tackling stress and emergency situations, whereas parasympathetic assimilation of food, conservation of energy, like you're resting. So we have some receptors to which our neurotransmitters are bind. First one is the alpha 1 receptors, and second is the alpha 2 receptors. So we can see that blood vessels alpha 1, alpha beta 2. So the epinephrine or epinephrine will bind to these types of receptors, like they are adrenergic receptors. So alpha 1 is the stimulatory, like it will cause vasoconstriction, relaxation of smooth muscles, GIT smooth muscles, salivary secretion, and hepatic glycogenolysis. Whereas in alpha 2 receptors, when epinephrine is attached, then there is inhibition of transmitter release. Include the noradrenaline, acetylcholine release from the autonomic nerve. There is a platelet aggregation. There is a contraction of vascular smooth muscle and the inhibition of insulin release. You can see that what is happening in blood vessel when alpha 1 is stimulated, there will be constriction of smooth muscles, whereas in beta 2 there will be dilation of the smooth muscles. Again in heart, beta 1 are stimulated, then tachycardia. Alpha 1 is stimulated, increased contractility. Beta 1 receptor will cause the increased cardiac rate and force, whereas the beta 2 receptors will cause the bronchodilation, vasodilation, relaxation of visceral smooth muscle. It will cause the glycogenolysis and muscle tremors. And beta 3 receptors will cause the lipolysis. These are the functions of these types of receptors present on various tissue. Some are stimulatory, some are inhibitory. There is another type, that is cholinergic receptors. The two types of receptors that bind ACH are Nicotinic and muscarinic. Nicotinic receptors are found on the motor end planes like somatic targets. All ganglionic neurons, like midway in the ganglion, there is nicotinic receptors of both sympathetic and parasympathetic division. Hormone producing cells of the adrenal medulla have the nicotinic receptors. The effect of acetylcholine, if acetylcholine is bound to nicotinic receptors, then the action will always be stimulatory, not any inhibitory. Whereas muscarinic receptors occur in all effector cells, which are stimulated by postganglionic cholinergic fibers. The effect will be can be inhibitory or excitatory, depends upon the receptor type. This type, receptor type. Like some will have the stimulatory, some will have inhibitory action. Yeah. So regulation of the autonomic nervous system. Autonomic reflex control most of our activity of visceral organs, glands, blood vessel. What happens to your body when you're running? What happens when you're resting? These are all regulated by our autonomic nervous system. Autonomic reflex are influenced by the hypothalamus and higher brain centers. But it is important to mention that hypothalamus has overall control of the ANS. Means hypothalamus is the boss. Sympathetic and parasympathetic divisions influence activity of gut, but the enteric nervous system is independent. These involves, but the enteric can function independently, as I already told you, through local reflexes. When the wall of digestive tract is stretched, sensory neuron will send information to enteric plexus, then motor response sent to the smooth muscle of gut. It will not go to the higher centers, but higher centers will can send higher centers can send their effect on enteric, but enteric will not send their messages to CNS. Centers of hypothalamus control, like uh, it will heart activity, blood pressure, body temperature, water balance, endocrine activity, emotional stages like when you are in rage, pleasure, biological drives, hunger, thirst, sex. These all control have their centers on the hypothalamus. Reaction to fear and the flight or flight system. So, what are the levels of ANS control? The hypothalamus is the main integration center, overall integration of ANS, the boss. But it receives some subconscious information from the cerebral cortex and limbic lobe, emotional output, just like. So, again, hypothalamus will control all these centers. Like it is a center of regulation of pupil size, respiration, heart, blood pressure, swallowing, and other. So we will now talk about the synapse. What is a synapse? Synapse when two neurons meet, and this is called the synapse. So action potential cannot cross this synaptic cleft. Like action potential from this neurons can't cross to this one, and can't cross this synaptic cleft. So it has to release some chemicals which are called as neurotransmitters to act on these receptors. Then they will regenerate the action potential further. So presynaptic neurons, this is called presynaptic. This is called postsynaptic, presynaptic left,